9:13, welcome back to Morning Break. Dr. Brian Rhodes has joined us at the table from Catawba Radiology.
Hello.
Good morning.
Good morning to you.
We're going to talk about varicose veins, but I think first an example of what are they? What is the definition of varicose veins?
So varicose veins are kind of, a lot of people are familiar with them, the kind of ropey big veins that you see in your legs. And they typically develop, within the veins you have valves, and those valves are one-way valves that bring the blood back to your heart.
Okay.
And when those valves malfunction, the blood pools in your legs, and that's what causes the bulging of the veins.
That's why you see the big veins.
Right.
So a lot of folks don't like the way they look, but they are an indication that something's wrong with your circulatory system, and it's something that you want to get checked out, not only for cosmetic reasons, but for health reasons as well.
Yes, yeah. Primarily, the typical patient that we see is a woman over the age of 50, and oftentimes people do come in for cosmetic reasons, but if they're not treated early, potentially it can develop into more serious problems, including swelling and even ulcers can develop in your legs.
You were saying that you can develop ulcers of the skin, you can even lose limbs because of this, and I thought it was pretty telling that women are more apt to come in early with this. Men typically wait until the signs have gotten much worse, until they're having those circulatory and ulcer problems, right?
Yeah, that's pretty true across the board for most medical problems, I think.
Stubborn men, we just want to wait.
Right.
Let's take a look at a before and after picture, because there are treatments for varicose veins. On the left, you can see the pre-treatment, and on the right there, our morning break timestamp there is a little bit covering it up, but you can see that it is a fairly significant difference in the way that it looks.
Yes, so you can see on the left the picture of the bulging veins within that calf. So usually the way we'll diagnose these is with physical exam. Obviously it's pretty obvious, you can see the veins on the legs. But we also have the patient get an ultrasound, which kind of evaluates those valves that I was talking about.
Pretty easy treatment?
It is a pretty easy treatment. Historically, in the past, it was a pretty invasive surgery where they would strip the vein out with a long recovery.
Yeah.
But interventional radiologists such as myself have invented this minimally invasive procedure, and it's really an outpatient procedure now. It takes about an hour.
We are about out of time, but quickly tell us where we can find you guys online.
You can either Google Vitality or Catawba Radiology, and we perform at Vitality Med Spa. It's kind of a very nice, low-key place.
Right. Dr. Rhodes, great information. Thank you for coming in.
Thank you very much.